Medical professionals, what is the stupidest misconception a patient has had about the human body? Now let's read some comments. I still remember reading a Reddit comment from a doctor years ago that they were telling the person they were about to lose a finger. They said the person seemed way too okay with it, so the doctor asked how they were handling it so well, and the person genuinely told them that it won't be too bad because at least fingers grow back. It began a whole slew of comments from other doctors with patients who had the same misconceptions about limb amputations. Oh hahaha. Yes. Of course I know that human limbs don't regenerate because I'm a real human. I was just making a joke. They must have seen Deadpool and thought to themselves, what a shot superpower. Mom brought newborn to the earth because he keeps making grunting sounds like he can't breathe. No sounds like this during the exam. They ask mom to try having baby latch/nurse. She doesn't, baby is fine. Sometime later pages the nurse because he's making noises. They were bowel sounds. Normal bowel sounds. Hilarious, but she was worried 10/10ths good mom. Patient comes to the ER with an infected foot wound and streaking up the leg. Turns out they were walking barefoot on their porch and stepped on some metal scraps. Don't remember what they were from. Patient tried to remove these, but evidently a piece of one broke off in the process and was too deep to see or grasp properly, so they left it in there for over a week. Reasoning was, I thought it would fester out. Patient with seafood allergy presents to her with swollen lips, hives, itchy throat. Provider takes a history asking if the patient cold been exposed to seafood or cross-contamination. Have they eaten new food or at a new establishment? The whole nine. While being treated, patient adamantly denies this. They keep trying to figure out what the allergen cold been because it's a pretty strong reaction. Eventually the patient gets frustrated and admits they ate shrimp pasta, but it can't be from that because he took 2 tablespoons of honey first and it coats things in there. As in, shrimp can somehow not penetrate the magical honey fortress. Nurse here. We work with patients with kidney issues. Our biggest misconception. The product no salt is totally safe to eat. Wrong. No salt is a potassium-based product to mimic salt texture for food, but now puts you into a whole new issue with having high potassium from frequent use, leading to cramping, arrhythmias, and even death. Edit. I saw this picking up and wanted to clarify. You can eat potassium in your diet. Fruits and vegetables are always safe to eat as long as they are not in high excess. Eating 8 potatoes a day is not what I'd call an average diet. The problem with the shaker design is you can't regulate how much you're putting on, and most people don't record daily quantity. If your doctor is prescribing you potassium tablets due to hypokalemia, that is a safe example of a good potassium intake. My mother, a doctor, volunteered to give a health lecture to high school girls in the South, Arkansas to be precise. During the CAP period, when she asked if anyone had questions, a girl asked her if it was true that lemon juice was a good contraceptive option. She didn't understand, so the girl explained that after her boyfriend came inside of her, she would squeeze lemon juice into her vagina to prevent pregnancy from occurring. I wasn't there, but can only imagine the look on my mother's face, based on the way she reacted to my idea throughout my childhood. That was an old school birth control technique, before we had any pills or modern methods. A sponge soaked in something more acidic like vinegar or wine, tucked up against the cortex, so sperm would be killed by the acidic environment. Not just lemon juice directly up the hoo-ha, though that would just cause problems. I mean, boiling water is a contraceptive in the same way. I mean, if she's trying to change the pH so much that pregnancy isn't possible, that's not a bad idea on paper. It's just that constantly doing that will more likely lead to chemical burns and pregnancy. Wanting a wheelchair to be made wider, but not wanting it to actually be wider. Client comes to my wheelchair clinic saying the chair got too small, they gained weight, but want to blame the wheelchair, and could I get them a wider one? I can actually adjust the current one, but just before I get the toolbox I ask about any narrow doors. Turns out the current setup only just fits through her front door. If I make it even 1 inch wider she won't be able to get in her house. Took a while to get her to understand that widening the chair does indeed widen the chair, and no, I can't widen the seat without widening the overall width. I've had many others from wheelchair clinic. I accidentally told the parents of a 6-year-old nonverbal, not independently mobile child with global developmental delay that she would never be normal. They thought developmental delay meant she'd catch up eventually, like the difference between a train being delayed or cancelled. I had to clarify and explain their daughter would never live independently because apparently everyone assumed they knew and never explicitly told them. Clients who haven't walked in years but still don't want a wheelchair that will give them independent mobility because that's giving up. They are still determined to walk and in the meantime will rely on being pushed everywhere. I just feel sorry for them. Their lives could be so much better if they accept what they have and let me help. We now keep a mini plastic skeleton in the clinic room so I can explain what bones look like when sitting. It's used regularly with people who just can't understand what the bony parts they can feel under their bum are. I had an amputee kid wondering when his leg will grow back, but he's a kid and can be forgiven for that. Fortunately no adults with the same question yet. I used to use a cane. Foot surgery. Long story. I went on vacation with a bunch of people and there was a guy there with severe back pain. It really restricted what he could do. He told me that using a cane was a sign of a weak spirit. I told him that I was using a cane because I didn't want to screw up my back. He didn't make the connection. How did the parents take that one? Hell of a blow to suddenly realize the truth. Regarding the developmental delay story, I understand. We've been through so many cycles of euphemism that at this point we are on the phrase developmental delay, which is pretty far from the truth of the situation. The phrase, taken literally, implies that the development is still on track and just lagging behind. In reality it's more often that development is derailed without any expectation of continued growth. What do you mean? I can't eat an entire fruit cake. Isn't fruit supposed to be healthy? Diabetic type 2 with a blood sugar level of 450 mg/dl. My colleague's husband was diagnosed with type 2 diabetes last year, and since I've had type 1 diabetes for 23 years, I was giving her some advice on nutrition, etc. It killed me when she brought in the healthy alternative to chocolate her husband had bought, enormous raspberry and white chocolate muffins. A single muffin must have had around 4x more sugar than a chocolate bar. I watched my diabetic father mix a spoonful of sugar into his strawberry milkshake, which my mother made with plenty of sugar. I literally watched this man slowly kill himself every day. This is some dumb shot he'd say. Edit. I'm sorry to hear so many of the stories in this thread, but it's been very cathartic being able to vent with so many people in similar positions. I hope your stories all have happy endings. I and other family members have tried over and over to educate husband's diabetic aunt. For most of her life her sugars ran high, but the last year or so they've been getting too low. You try to tell her that when her sugar gets low she needs to drink some fruit juice or eat some candy that's not sugar free, or maybe some peanut butter crackers or fruit. Her response? Oh, I can't eat that stuff. It makes my sugar go up. That's what you want to happen when it's 50 and you're lightheaded. She'll call and tell us about how she felt funny this morning, so she checked her sugar and it was 65. So what did you do, auntie? Well, I had a couple pieces of bacon and some coffee, but it only went up to 68. But I wasn't dizzy anymore, so I walked out to the backfield and burned trash. We are seriously considering staging a family intervention of some sort and telling her that either she sees a nutritionist and learns to care for herself, right, or she can't live alone and be a fee anymore. Or maybe both those things. Is butter a carb? I had to explain to a pregnant woman once that the baby is coming out of her vagina. She was almost 6 months pregnant and was horrified. I think she thought all babies were just C-sectioned out. I overheard a guy talking to another at a pregnancy clinic. I just don't get it. She was standing up. The sperm would have just come out. How is she pregnant? And both of them seemed very confused. One person didn't think the stroke they were having was a big deal because they could get some brain transplanted from donors, right? I couldn't even. There's so many. A loot of people on medication and they have no idea what they are taking it for. Oh, do you have any health conditions? No. 10 minutes later I re-ask, no conditions? No diabetes? Or high blood pressure? Oh yes, I have those. Just, oh lord. Welcome to Ertridge with that last one. Ooh, this is the bane of my existence. Patients seem to think that because they take a medication for a condition, they no longer have it. Get to the end of the medical history, no conditions. Great. Any medications? Suddenly they are on 20 drugs and had a stroke 3 weeks ago. Oh, do you have any health conditions? No. I don't think regular people realize what a staple doctor-patient exchange this is. This isn't some isolated thing. It seems like this particular exchange happens all the time, everywhere. Diabetes, high blood pressure, like you mentioned, those aren't real conditions when medicated. There's no need to even mention them, is probably what's going through a lot of patients' heads. I like the Gomma blog satire article on it called Patient with no past medical history has sternotomy scar, central line, G-tube. My personal favorite was a guy who vomited blood several times a month before being treated for something unrelated. Never bothered to talk to a doctor about it. Not even me, until I was literally leaving the room after thoroughly investigating his current issues, and when something he said seemed off. People not knowing what their medications do. I'm convinced there's more of them than those that do know what they are taking. I know there's reasons for these things, and you have to keep professional, but sometimes you think, just, dude, wow. The pregnancy ones make me sad. There's such a lack of education out there about pregnancy and childbirth. I was surprised by all the things I didn't know before I got pregnant, although luckily I was aware of how the babies come out lol. I wish I hadn't been this person once. I was in a lot of pain, just dislocated a rib, and wasn't thinking too straight. The nurse asked me if I was taking any medications, and I told him no. Then about 15 minutes later I offhandedly mentioned my birth control. I still internally cringe over it. Sometimes I'm the lol. I'm a dentist and the thing we get all the time that I hate is parents not caring about their child's decay because they are just baby teeth. Losing baby teeth early causes all sorts of problems aside from the pain and trauma, but in addition to that I often have to explain to parents that the adult teeth that erupt at age 6 are meant to last forever. They're always oblivious. How do you convince a guy to brush his teeth when he thinks he's immune to cavities? BC the dentists he goes to always tell him he has good teeth. Not the dumbest, but most recent. I had a patient who needed a tooth extracted. Young teenage girl, obviously very sheltered. She was telling me how bad it hurts, and I asked her what she takes for pain. I apply a little clove oil to it when it keeps me up at night. I asked if that works, and she goes not really. When I told patient and mom to control post-operative pain with ibuprofen and acetaminophen, they looked at me like I had grown a second head. Usually older generation believes that medicine takes a toll on our internal organs. It makes you more sick, they say. That's why when I have extreme headache, I tend to drink medicine in secret, because I'll be reprimanded. I remember when I was younger, I had dengue, but it was more than a week before they got me to a hospital, because we went to a faith healer / quack doctor first. Clove oil is a decent topical anesthetic for the mouth, but give me that ibuprofen. I had a dry socket after a wisdom tooth extraction. Always follow your surgeon's aftercare instructions exactly. I didn't. 800mg ibuprofen every 4 hours only dulled the pain by half. Clove oil jelly packed in there helped a bit more. I offered a diabetic a tissue after doing a finger prick to mop the 2 drops of blood on his finger. He looked at me like I was an absolute idiot, said you don't know very much do you, and sucked the blood off his finger. Then spent the next 5 minutes educating me that because he was a diabetic, he needed all the blood he had. Therefore he needed to put it back into his body rather than wasting it by putting it on a tissue. He was under the impression that if he just drank his blood it would go straight back into circulation. Edit. Guys and girls, thanks so much for all the awards, upvotes, and comments. But please stop, I literally can't get through it all, and I want to go to bed. Oof, the blatantly wrong lectures are the worst. So I've never heard that one before. That honestly doesn't surprise me though. I'm a pharmacist who manages some diabetes at my IHS site on the side. I once had a patient call and ask what dietary things they could do, and I told them they needed to eat less fry bread and potatoes. They all eat mountains of both. She said, but I boil my potatoes. Well, they are still made almost entirely out of starches, which are carbs. Boiled or not, they're still going to raise your sugars. No, but I boil them. Yeah, doesn't matter. I don't fry them, so it's okay. Nope, still super high in carbs. I hardly eat potatoes anyways. Took you several tries to figure out what you thought I wanted to say, did ya? Well, I had one girl that really thought if she had socks in the shower she could not get pregnant because all the sperm must fall out and go down the drain. Her boyfriend had been convinced as well. They did, indeed, end up pregnant. There had been a lot of stand-up shower socks. I caught a patient drinking his own urine once. He thought it would help heal him, somehow. I have never looked at a water pitcher the same way, and I always check to make sure it's water. The one is about a nurse. I had to help another nurse put a Foley catheter in, a sterile tube that drains urine from the bladder. She, new nurse, had been trying to put the catheter into the patient's clot. Needless to say, the nurse was confused, and the patient was confused as well. When I put the catheter into her urethra, obviously not her clot, it felt much worse for the patient than what had previously been going on. My mother asked me once, completely serious, why brain transplants were not possible. She didn't understand why, if you had an inoperable brain tumor, they couldn't just pop a new one in there, like it was a heart all over. I tried to explain to her that it wouldn't be the same person, but she just stared at me blankly. I love my mother, but that was probably one of the stupidest conversations I've ever had. My favorite was a patient calling my department 3 times with concerns about having to abstain from taking her blood pressure medication prior to an exercise treadmill stress test. She's afraid one missed dose of her metoprolol would give her a heart attack. She is very concerned because her blood pressure is so high these days. So I asked her if she's taking all her prescribed doses. She said she's supposed to take it twice a day, but often she only takes it in the morning, and only half of what her doctor ordered. So effectively this lady was taking 1/4 of her BP med and couldn't figure out why her pressure isn't under control. I've had a few good ones, but the funniest actually happened during my first year of college studying PT. Someone raised their hand in a NP early on in learning about muscles, their attachments, actions, and innovations. She asked why humans don't have meat like cows, pigs, and other edible animals. Prof stalled for a second holding it together, then asked if anyone else was wondering about this. Roughly a third of the class, perhaps 20 people, raised their hands. She spent the next few minutes explaining/convincing people that muscles are in fact the meat. It was hilarious. Edit. Also, I asked her after class. She said it actually wasn't the first time she'd been asked that question. Not me, but my sister, currently in residency. She was with a patient who had a severe pain in her thigh. They screened her, ran thousands of tests, and nothing came out of it. They later found out she had a bullet in her arm, but that it had hit her from behind, so it couldn't be seen. When she laid down on her back, she thought her thigh was in her arm. I seriously do not get how they didn't find it, since this is more common in her situations, but I guess mistakes slip through sometimes. Edit. I don't understand either why the lady didn't point out the fact that they were checking her leg instead of her arm. But she was supposedly very problematic in general, and I just feel gratitude to the healthcare workers who have to be nice to people that behave like us. Not a medical professional, but I have a major medical condition that can damage the lungs. If one is having a flare of said disease, a great big warning sign is coughing up blood. So, every single doctor I see, no matter the speciality, asks if I've coughed up blood. I finally asked one time who in their right mind doesn't call the doctor or 911 if they are coughing up blood. The doctor looks at me and says a whole lot of people. I did work in care management for medical insurance. One day I was doing paperwork and the care coordinator next to me busted out laughing. When I asked why, she said that the man who was on the phone with had just had quadruple bypass and was on his way home from a month-long stay. He was calling to coordinate his cardiac rehab. While on the phone with her, he was ordering his 20-piece from KFC. She said you have to laugh or you will just hate the world. Oh god, that reminds me of when I was a kid and fell off the monkey bars at recess. I coughed up blood for a couple days and didn't tell my parents because I didn't think it was a big deal. Even now I'm like, what was I thinking? Thankfully my mom found out and took me to the hospital and I ended up being just fine. This isn't so much a misconception about the human body, but when I was a nurse a common misconception from patients was that I was testing their urine for drugs and that I would call the police or report to their employer that they popped positive for something. If this has ever been you, know that it is illegal for us to disclose a drug test performed for medical purposes to anyone without your permission, including the police, aside from litigious situations when it's required. If the police brought someone in handcuffs and wanted a drug and alcohol test, it was a whole lot of paperwork, and if I remember correctly, they needed a court order. Also, I do not give a shot if you do drugs. Just tell me the truth so I can help you and so I don't accidentally give you something that could interact with what you've taken and make things worse. The conversation stays between us and the doctor, and I can assure you we don't give a duck and we would be fired for disclosing that information to anyone without your permission. Thanks for watching. Hit the subscribe button and activate the notification bell for more videos. Also like the video if you enjoy it.